Hello, my name is Eric Forehand. I'm the uh, Design and Brand Manager here with the North Carolina Partnership for Children, and we just really like to thank everyone for coming to the Smart Start virtual conference. We are sad that we can't have the in-person conference like usual, but we are very thankful to have these presenters and stepping up and helping us share the content virtually for the network. As Scott said, we've got a pretty large turnout today, so just try to keep your mics muted. And then, yes, if you have any questions, feel free to just post them in the chat box. And I believe our presenters will be posting questions to you all occasionally in there as well. So without further ado, please welcome Christine Murray and Camila dos Santos and their presentation on promoting healthy families with resources from Healthy Relationships Initiative. Take it away.
Thank you, Eric, and thanks to everybody for being here today. We were thrilled to hear what a big turnout we had signed up for today's presentation. So we're really glad that you're here, and we do invite you to use the chat room. Please feel free to share questions at a few points. We would love to ask you some questions too, so don't be shy today in the chat room. We were hoping to have a really interactive in-person session, so we're hoping to have some of the interactive pieces today as well. I'm going to start by giving an overview of the presentation and an introduction to myself, and then I'm going to turn it over to Camila, and she'll introduce herself as well as get us started with our first discussion for the chat room. So my name is Christine Murray, and I am the director of the Healthy Relationships Initiative, but I'm also the director of the Center for Youth, Family, and Community Partnerships at UNC Greensboro. Prior to starting in that role within the center, I was a faculty member and oversaw the couple and family counseling program in the counseling department at UNC Greensboro for 14 years. I also am really thrilled to be part of this Smart Start conference because I work very closely both through the Healthy Relationships Initiative and in other ways with our local Guilford County Partnership for Children, including that I serve on the board for the partnership. So really excited for the opportunity to present with you today. And I'll just really briefly share real quick about the Healthy Relationships Initiative, and I'll talk more about it in a few minutes. But the Healthy Relationships Initiative is a community-based initiative that's housed within the Center for Youth, Family, and Community Partnerships. And we work to promote happy, healthy, and safe relationships of all kinds in our local community as well as beyond. So with that, I'm going to go ahead and turn it over to Camila.
Good morning, everyone. So glad that you're with us today. Really exciting to see how many turned up. And as Christine mentioned, my name is Camila dos Santos, and I have the awesome job of being the program coordinator of the Healthy Relationships Initiative. Before I took on this role, I was a school counselor, and I've worked in elementary schools as well as high schools. So really passionate about working with youth, and really excited to be here with you today and talk a little bit about how we can best support healthy relationships in the families that we work with.
Uh-oh, my screen isn't moving forward. Oh, there we go. Okay. Sorry, Camila. We should have tested that part out before we started too.
That's all right. And so as we mentioned, we really want to make today as interactive as we can. And so I'll start by just asking some questions that we would love for you to just provide your input in the chat room. The first question, and I'll go ahead and copy this in the chat room as well so you have it. But the first question is, what are some of the characteristics that you would use to describe what it means to have a healthy family? So what we're looking for here are just some words that come to mind when you think about a healthy family. What are some of those words? I'm seeing some great answers, and what's very ironic, and maybe not ironic, we see it often, is communication is one of those top things that people tend to use to describe healthy relationships. So I'm seeing support, teamwork, fun, enough food, absolutely. So it's really difficult to worry about sort of our relationships when our basic needs aren't met. So meeting those basic needs, having food, of course, prioritizing each other, nurturing, understanding, love and laughter, saying some really great words, but what I'm also seeing is some reoccurring themes of communication, of respect, forgiveness. So thank you so much for that input. Keep sending that in. And while you're doing that, I'll go ahead and ask you a second sort of follow-up question. So as you think about these characteristics for a healthy family, what are some of the barriers to achieving healthy relationships with the families that you serve in your work? So we know that, the goal is to have healthy, happy, and safe relationships in our families, but we also know there's a lot of barriers that get in the way. And so I'm seeing here lack of resources, stress, lack of support, lack of communication, trauma. Trauma is definitely a big one that we see when we work with families. Closed-mindedness, poverty, trust, substance abuse, policy level barriers, knowledge, commitment. So these are some really things, and I'm seeing some reoccurring themes there as well. So we really appreciate your input. We encourage you to keep sending that in the chat room. And I know that
Andrea, I believe you need to go back to bed.
No, we're getting in court.
Well, I don't like what I'm
For a
hearing.
second, and please have everybody mute their phone.
Somebody.
Me too.
I'm sorry, I'm having trouble finding this person.
That's all
We'll
right.
wait just a moment so that
Yes.
we are not trying to talk over. So-
Scott, I think I might have gotten it.
Okay.
Good, thank you.
Thank you so much. Well, thank you everyone for your input. It was really interesting to see that despite the fact that we all sort of use some different words, we definitely had some reoccurring themes there. So hopefully throughout the presentation today, you will find some resources and some strategies to hopefully combat some of those barriers.
All right, yeah, thank you. And that was a great kind of warm up to show how many different pieces of healthy relationships, but also how many barriers there can be for having healthy relationships. And one of the most common things that I usually say when we're out talking about healthy relationships is that a lot of what we're talking about is not rocket science. It's not too complicated. And in fact, we prefer to try to keep things as simple as possible. But the real challenge is in sort of implementing the things that help to promote healthy and safe and happy relationships. So in some ways, the work that we do is somewhat simple because we all have a basic understanding of what healthy relationships are. But in many ways, it's very complicated because in the real world, relationships are complicated and families, lives, and all kinds of relationships have a lot of different complications. So I'm going to tell you a little bit about our work and an overview of the Healthy Relationships Initiative, and then we're going to walk through some of our specific components of the initiative. We do invite you to connect with us online through our website, which is at guilfordhri.org, as well as find us on social media. And we actually just last week changed our social media handle. We're looking to expand really a lot more beyond Guilford County. So on Facebook, on Instagram, and on Pinterest, you can now find us at Healthy Relationships Initiative. And you can also find us on Twitter as well. But as I mentioned earlier, our mission through the Healthy Relationships Initiative is to promote happy, healthy, and safe relationships of all kinds in our local community and beyond. The Healthy Relationships Initiative is a partnership between UNC Greensboro and the Phillips Foundation, which is a local family foundation here in Guilford County, North Carolina. After a 2-year planning process, we first launched the initiative in February of 2017. So we've been sort of in full operations now for over 3 years. And we work very closely with a wide network of different community partners, but we really find it important to focus on relationships of all kinds. So while you all in the Smart Start population are focusing on that early childhood stage, and we're going to talk a lot more about that later, we also have resources for all different types of relationships, whether we're talking about couples, marriage, families, parenting, workplace relationships, friendships, and virtually all types of relationships, and also just a lot of resources around general relationship skills. So our goal has really been to work with different community partners. In fact, since we started, our charge from our funder with the Phillips Foundation has been not to be a standalone organization that works in isolation, but we try to build healthy relationships with our community partners as well, and really working with those community partners to look at different ways of reaching different segments of the community. So on our website, we redesigned it a year or so ago to make it as easy as possible to connect to our resources. So the first block that you see there, and if you were to go to our website, would be how can we help you today? If you click on that link, which we're not going to do today, but if you do click on that link, it'll take you to the different populations to try to make it easier to find resources, whether it's parenting young children, parenting teens, couple relationships. So that's one main section of the website, as well as the second block there takes you to our events. We have always done a lot of online programming, which Camila will share with you a bit about our e-learning center in just a moment. We have, of course, really stepped that up in recent months to address the pandemic, and a lot of our face-to-face programs weren't able to happen, but we already do a lot of online programs. And then you can also, of course, learn more about the Healthy Relationships Initiative. But we have three main components that we use through the Healthy Relationships Initiative, and those are community mobilization, social marketing, and healthy relationship education programs. So just to give you a little bit more of an overview of our work, I'm going to go ahead and we'll walk through each of those three categories so you can understand some of the different ways that we work. And much of what we do is local in Guilford County. So in part, we want to share that for those who are in different communities as examples of other programming you might establish in your local community. But as I already mentioned, a lot of our work is online, and it's really not limited by geographic boundaries. So a lot of the resources, regardless of what community you may be in, could be helpful for you. But as I mentioned, our first major component of our strategies that we use is community mobilization. And so this is where we really work in partnership with a lot of different organizations. Up until very recently, we had a standing steering committee, which eventually became a partner leadership council, which was sort of an advisory group of different community partners. But even beyond a formal advisory group, as I mentioned, pretty much all we do is in partnership with different organizations. And I'll share just a few examples of some of the ways that we've partnered with different organizations to reach different segments of our community. So since we launched in February of 2017, so now we've done this 4 years in a row. Every February, we partner with the Greensboro Children's Museum. And every Sunday in February, we do something with them called Sundays Unplugged. And this is where they offer a discount or actually free admission to any adult who turns in their cell phone at the front desk as a way to encourage adults to unplug from technology and to connect with the children in their lives. And so I wanted to share that as just one sort of creative example. There's not a lot of financial commitment. It's a relatively simple strategy, but it's something that can be done to sort of help offer benefits to people in the community, such as through that discount, but also help kind of people think more about their use of technology. We all know when we go to children's museums, some of the parents are very engaged with their children, and some parents are just tuned out. They're on their phones. They're barely paying attention to their children. And we do not judge either, because I will say, as a parent myself, when my kids were younger and we went to the Children's Museum, there were lots of times when I needed to just check an email at work while my kids played happily. So it's not about judging people, for different ways. Of course, that's one reason why sometimes parents might go to a place like the Children's Museum to kind of have a break. But we try to help people think about the ways that their interactions with their families and the young children in their lives impact them. So for those of you, for example, in childcare programs, that could be something, a relatively simple thing that you could do is maybe encourage some technology-free time among the parents and families that you serve. As just one other example, we have partnered in many different ways with the YMCA of Greensboro since we launched. And one of the things specifically that we did was we developed a set of messages about healthy relationships that were shared through their youth sports programs. And so the coaches or the sports directors would just send that out as an add-on to their regular messages that they would send to the youth and the families involved in the youth sports programs. And again, it's just another example of how when we're working together in partnership with others, we can look for different ways to get that information out into the community that don't cost a lot of time, don't cost a lot of money, but that are really effective in meeting families where they are. One of our charges really from, again, the Phillips Foundation has been to take information about healthy relationships and families out of the clinic, so out of counseling environments. As I mentioned, my background is in the marriage and family counseling world. So how do we take that out of a clinic and get it into the community? And so that's what we're always really trying to think about through our community mobilization and our partnerships. Another really big piece of our community mobilization strategies is our lived experiences professional trainings. And this is something that we've now been doing for about 2 years now. But again, we partner with different local community groups to offer professional trainings on topics that affect people in their lives and in their families and relationships. So we've done several of these programs right now. The most recent one was in February, and it was on overcoming domestic violence. We partnered with our local Family Justice Center with a panel of speakers to share their experiences. And we really believe in elevating the voices of people who have lived experiences of some of those different challenging topics. So those are a great resource, especially for those of you who are closer to Guilford County and might be able to come because they're really powerful professional trainings. For our September one, we're looking at doing one on parenting and addiction, which certainly would be of interest to this population. And we are just in the early stages of our planning, but we're going to be considering the possibility of either doing that in person or virtually. That's just another example of some of the programs that we include. So I'm going to turn it back over to Camila to talk more about our social marketing strategies.
Yes, thank you, Christine, for giving that background of our first component of HRI. And now I'll go ahead and dive into our second, which is our social marketing piece. And undoubtedly in the pandemic, it's proven to be a really big part of the Healthy Relationships Initiative. And so really through our social marketing activities, we really just want to provide a foundation for all of the other areas of our work. So our goal is to use face-to-face media and social media outreach to just disseminate the messaging and the tools that we have about healthy relationships. Of course, right now we're not doing as much face-to-face and we're not doing any face-to-face and we're staying totally in the virtual world, but our goal is to continue to bring those face-to-face programs to the community as soon as it's safe to do so again. We also do a lot, as Christine mentioned, we do a lot of events in partnership with other organizations. So whether our outreach is something that we're doing on our own or hosting with others, we really believe in the power of just setting up exhibits and talking about healthy relationships with different populations. One example of sort of this online media outreach that we do is we've had an opportunity to work with the Triad Moms on Main, which for those of you who are local to Guilford County might have heard of it. It's a very popular local parenting blog. And so we provide sort of like an advice column blog, and that's been really successful, and we've really enjoyed that partnership. We also do a lot on social media, which has been very helpful during this pandemic, of course, and actually the best way to stay up to date with what's going on in our world in terms of news and events and different resources would be to connect with us on Facebook. As Christine mentioned, we just changed our handle, so now you can find us on Facebook and Instagram at Healthy Relationships Initiative, and we're also active on Twitter and Pinterest. And so I'd like to encourage you to take a look at the slide in front of you, and I'll walk through some of the different resources spotlighted there. In the upper left-hand side, you see our website, and we'll dive in a little bit more into our e-learning center and the resources available there. But in the upper right, we have our HRI e-newsletter, which is a really great way to connect with us and kind of learn about what we're doing on a monthly basis. We talk about our different events, and then we also share some resources for all populations. So we share resources for providers and for parents and for different kinds of relationships as well. If you're interested in signing up for our newsletter, I'll be sure to share that link with Scott, and that will go out in a follow-up email as well. We'd love for you to connect with us, and we don't share your information with anyone, and we only send the newsletter once a month. So it's a great way to kind of stay in touch with what we're doing. In the middle there, you'll see a picture of the Healthy Relationships Initiative being spotlighted at the UNC Greensboro basketball game. And so that was really exciting. That was part of our larger event of the Healthy Relationships Week, where we, during the week of Valentine's Day, we provide consecutive days of programming, whether online or face-to-face, to support healthy relationships of all kinds. So that was a special sort of outreach that we did on UNCG's campus, and it was pretty neat. Christine received the game ball, and so we've got that in our HRI office, and it's a nice little tribute to the work that we've done so far. Another thing we're really proud of, and unfortunately had to cancel for this year, was the Family Village Resource Fairs. And this might be of interest for providers that are in our area, that are in Guilford County or nearby. And basically what we do during the resource fairs is we partner with a number of community organizations to provide and share information about resources to families of young children. It's a really neat event. We typically have entertainment and refreshments, and families get to walk through different exhibits and learn about the different kind of supports that families of young children have here in the area. Christine mentioned that we've done some different types of messaging, specifically with the YMCA of Greensboro. And so in the bottom left, you'll see one of the examples of that messaging. We created a tip sheet for parents with some different tips on how to connect with kids through sports. And that really sparked out of a need to just sort of work on building healthy relationships in terms of when parents get involved in their children's youth sports, and really making sure that those activities are opportunities to bond and not necessarily opportunities to introduce more conflict into the home. And so we're really, that was a really popular tip sheet. We tend to hand it out a lot at our family events. And in the bottom right, you'll just see a sample picture of one of our exhibits. We've got a go-to healthy relationships exhibit that we bring to different events that we either host, co-host, or are invited to. And so that'll just give you some different examples of the different ways that we sort of achieve our mission of social marketing. We also share a ton of resources through our HRI blog, which you'll find at guilfordhri.org/blog. Again, we will send you all of these links so you have easy access to them. But the neat thing about our blog is you can search through our blog for different topics, or you can kind of search through based on what we're posting that day. So there's a lot of different resources and just tip sheets and things like that for relationships of all kinds. And we tend to post something new just about every day. So we encourage you to stay up to date with that as well. And then I'll dive in to our e-learning center in a little bit more depth later on. But just to give you a brief overview, the e-learning center is where we house all of our online modules and toolkits for families. So this is potentially a really great resource that you can not only use to work with your families, but perhaps give to them so that they can also follow up and do some work at home. And each toolkit is sort of built around this framework of offering tools to just reflect, connect, and we'll talk about how we do that as well later on. So with that, I will sort of move on to this next piece, which is in addition to the social marketing component of HRI, the third component of our work has to do with educational programs. And of course, that looks a little bit different right now, but in general, HRI does a lot of relationship education programs focusing on sort of these basic skills that support healthy relationships of all kinds. And so first, we do have a suite of face-to-face relationship education programs and workshops, and these are readily available for organizations. And so if you take a look at the screen, those are some examples of programs that we already have packaged and ready to go. And so when we're sort of living in a world that we can deliver these face-to-face programs again, we do encourage you, if there's a program that stands out to you that would be beneficial to your organization, we'd love to talk about possibly coming out and delivering that program in a face-to-face or perhaps even a virtual format as well. So currently we are able to offer these programs to local nonprofit organizations and schools. And we do have a number of different topics as we've mentioned. So we'll share a link to help you easily connect to that as well. And so let's come back to the e-learning center because we're really excited about this. We have free online relationship education programs. And what's really neat about these educational programs is they can be completed in an hour or so, and they don't have to be completed all in one sitting. So we know we're spending a lot more time at home, but that doesn't necessarily mean that we can sit at our computer for an hour without being interrupted. So these programs are designed for you to complete on your own time and at your own pace. Currently, we've got 3 of these relationship modules available, and they're focused on couples conflict, couples and finances, and perhaps of most interest to this group, parenting excellence. So these could be some resources that you can share with families that might be struggling in different components of parenting. We're excited to be releasing some new programs soon, and those will focus on healthy relationships for teens, single parenting, and then also building a team framework for parenting. So those will potentially be some great uses for this group as well. And so we'll share the link with that. One important thing to note about the e-learning center is we do work with UNCG faculty and students in the library and information studies. So we do believe these programs are user-friendly, and they're also, we also do our best to make it as engaging and as interactive for you to complete, so we can make it fun too. As an insider tip, and we'll have a couple of those throughout the program today, I'll share one thing that we have planned, which is basically we're hoping to launch some shorter videos through the e-learning center, some shorter targeted programs on things like how to apologize or how to diffuse a tantrum. And so the goal of this is to just sort of give parents and families some quick tips that they can tune into that maybe don't require that full hour commitment. We always welcome ideas for our e-learning center. So if you've got any ideas that sort of come to you throughout this program, go ahead and send that in the chat room. We will review that later, and we're always interested in serving the needs of the community and those of and the providers that are out there serving families. So if there's something that really stands out to you as a need, we'd love to hear it. And with that, I will hand this over to Christine as we've got some more questions for you.
All right, thank you, Camilla. I'm going to put our next discussion question into the chat room, and I'll also share it out loud too. So we're going to talk about kind of almost backstep a little bit about what is a healthy relationship. We talk about healthy relationships all the time. We are the Healthy Initiative, but what do we even mean by that? And so the question that we'd love to get your thoughts on right now in the chat room is the one that I've just written there, which is, what are some of the reasons that it would be challenging to come up with a way to define healthy relationships that it could apply across different cultures and across different types of, I mistyped it, it should say across different types of relationships. And back when we first started planning this initiative in 2015, honestly, that was one of the things that really me was how controversial even this idea of healthy relationships are. And it's something that we still sometimes get too. Like, people will say, well, are you just talking about healthy marriage? Or what about single parent families? And so again, if you have thoughts on this question, go ahead and share that, because as some of these points that are coming in, that there's different values about relationships, different cultural definitions, people have very different views. In fact, you would think something like healthy relationships would be something that people would be in general agreement that it's a good thing, but people do have some very different ideas about what that means. So I'm seeing lots of great ideas come in. I see one point, you know, maybe some people haven't even seen what a relationship looks like. It's hard to know that. Political correctness, different backgrounds, different values. We're also trying to look at what healthy relationships mean across many different types of relationships. And so what a healthy marriage or a healthy couple might look like could be very different from what healthy parenting looks like too. So there's different elements. So those are great. So keep those coming in while we go and talk to you about what our of healthy relationships has been. And we came through this through our different levels of research that we did, the needs assessment, our community survey, looking at existing research, literature, but we have really arrived at this different sort of conceptualization of what are healthy relationships. And I will add too, with my background in the family counseling world and having taught family counseling and couple counseling related courses for many years, I will tell you that even as a marriage and family or a couple and family counselor, a licensed marriage and family therapist, talking about healthy relationships is not often the focus of that training. We're often really looking more at kind of dysfunction and unhealthy patterns. And there's, even in the research, it's somewhat limited in terms of defining what that really looks like. So again, with our goal of keeping things as simple and as accessible for people as we possibly could, we've sort of looked at a spectrum of relationship quality. And you heard me say in the very beginning, our mission is promoting happy, healthy, safe relationships. And that sounds like something that's very simple, but in fact, when you dig deeper to it, we actually have a much deeper meaning behind that three-word phrase that we use so often in our work. So we're really talking about a real spectrum of relationship quality that looks at different levels of relationship quality that virtually could apply to almost any relationship. So we're going to break a little bit in terms of first starting with safety and relationships. And having safety in relationships is probably the foundation for relationships. It's hard to have a healthy relationship if there's not a sense of safety in that relationship. It's hard to have happiness in a relationship if there's not safety. So at the core, or at this foundation of safe relationships, we're looking at relationships for being free from any form of abuse or neglect or any other threats, whether it's physical safety, emotional safety, and any other threats to helping people develop. And I'm sure as early childhood care providers and education providers, that you all have seen a lot of examples, unfortunately, of the negative impacts of unsafe and unsafe relationships for children, especially. So to help people, we try to keep things pretty simple. So some ways to sort of examine whether a particular relationship might have that safety. Is it characterized by abuse, bullying, or other toxic dynamics? And we know that those types of dynamics, unfortunately, can present in, again, virtually any type of relationship. Does the relationship provide an emotionally safe environment? Is there a sense of emotional safety within the context of that relationship or family? And is the personal well-being of one or more person being neglected? So we really believe that safety in relationships is not just a physical safety, but it's also very important to have that sense of emotional safety. And those characteristics provide that foundation that help to build on the other characteristics of health and happiness, which Camila is going to talk about.
Yes, so as Christine mentioned, we're sort of looking at the healthy, happy, safe as a pyramid. And one of the things that would often come up when I was working in the schools is that when we were, working with particular families, we really wanted to get families to a place where they were functioning in a happy place, right? But if we don't have that foundation of safe, it's really hard to move forward in the pyramid to get to healthy and to happy. But ideally, we're all operating in the safe place. And if we're not, we can give you some resources and share some resources to help you get there. But once we've sort of achieved that safety in the family and those basic needs are met, now we can sort of set our sights on healthy relationships. And so although everyone's definition of what a healthy relationship is can vary, and we've talked about the reasons why they can vary. The core of healthy relationships of all kinds is built on respect, trust, safety, acceptance, freedom of choice, positive communication, conflict management, and a little bit of fun. So a lot of these words that we've just talked about, you actually provided as answers earlier on in the program. So while this can look different, right? Fun can look different for different relationships. Positive communication can look different. How you resolve conflict can look different. A healthy relationship will have these components. One thing that we always say in the Healthy Relationships Initiative is that perfection is not a requirement for healthy relationships, right? So even healthy relationships have their challenges and have their conflicts. But in healthy relationships, these challenges are opportunities for growth and learning. And so when we're thinking about this healthy, what does it mean to be in a healthy relationship? Some questions to consider are, is the relationship based on trust and respect? Are differences between people valued? Are they accepted? Are expectations communicated clearly? And are problems addressed with an eye for solutions? And then finally, is conflict managed in a healthy way? So some themes that you'll see there are positive communication, not a lack of conflict, but resolving that conflict positively. And so if you think about these questions as a way to sort of think about relationships being healthy, we hope that it will give you a framework to think about whether, when you're thinking about rating that relationship. And so when we move on, when we've gotten to that healthy piece of the pyramid, we all want to be functioning at the very top, right? We all want to have happy relationships. And so when our relationships are happy, in addition to being safe and healthy, they're joy-filled. And happy relationships, they offer people a sense of support and care, and they're nurturing. People in happy relationships really enjoy their time together and make that time a priority. They have a deep understanding of one another. So it doesn't necessarily mean that they agree on everything all of the time, but they have respect for and understand their differences. And so some questions to consider when we're thinking about, is this a happy relationship, or am I in a happy relationship? Would be, does the relationship provide a sense of feeling cared for? So you'll see that safety really comes in here too, feeling cared for, feeling nurtured. Do people enjoy spending time with one another? Do they laugh and have fun together? Do we try and understand one another? And do we really feel like we're there for one another when we're going through a hard time? So through these questions, you'll see some other themes that have come up before, which are the sense of support, understanding, and fun. So hopefully these questions make it a little bit easier to kind of sift through our definitions of happy, healthy, safe. And what's important to remember is that our relationships can sort of fluctuate through these different stages too. And so what's important to note is that as long as we continue to stay intentional about our relationships and continue to work through them, that's going to be a really important piece of the foundation too. But just also to keep in mind that different types of relationships can also fall in different parts of this continuum as well.
Thanks, Camila. And so just to add a little bit more too to what she said about kind of the big picture about that conceptualization, is hopefully even having this framework for happy, healthy, safe relationships is something that you may find useful as professionals. As Camila mentioned, understanding where somebody is on that spectrum can help to understand what resources they may need. So for example, if you're working with a family that's experiencing unsafe relationships, a referral to the local domestic violence agency might be useful, or other resources in the community related to those unsafe relationships. When people are struggling with more healthy relationship concerns, that might be pointing them more to family counseling or possibly to relationship education types of programs. And of course, when people are kind of moving toward that happy relationships piece, it's really looking at ways to build more meaning. So we hope that that conceptualization is just something that can be really helpful. I will say, even for me, as we've really developed that in my own personal life, it's been really helpful as a way to sort of check in on different relationships in my life and where they are. And hopefully you find it reassuring to hear that even somebody who works to promote healthy relationships all day, pretty much every day at work, there's still challenges in relationships, because relationships in the real world are difficult and complicated. So it's sort of helpful to look at that. And like Camila mentioned, different types of relationships can be at different points, and even for the same person. So we typically assume and expect that people in one area of life might, for example, have a very happy couple relationship, but really be struggling in their parenting. Or maybe they're doing great in their parenting, but they're struggling in their workplace relationships. And that's normal. Relationships are very complicated and challenging. So we hope that that's a very helpful, practical tool, even though it's just a framework, but it's something that can help you think about your own relationships, perhaps in your workplace or in your personal life, as well as the relationships among the families and children that you serve. So we're going to shift now pretty much the rest of our time. We're going to walk through some of the different resources that we have available specific to early childhood. As we've mentioned, we are focused on all different types of relationships. So early childhood is part of the work that we do, but we're going to set aside the other parts of the work that we do for the next part of our presentation and really focus on the work that we've done around. And again, much of this is done in partnership with other organizations. So we definitely did not really set out when we first started to do a lot around early childhood. That was one part of what we've done, but it's turned out to be one of the major areas of our work. And to some extent that reflects local needs and local happenings in our community. You who are familiar with Guilford County know that there's a lot happening in the early childhood world. And so bringing that healthy relationships and health perspective is something that reflected some community needs, but also we just know that those healthy relationships very early in life are so important for setting a foundation for positive development overall, as well as for young growing into a place where they're going to be able to establish healthy relationships in their lives too. So these healthy relationships in early childhood are so important because they help to promote positive childhood development in so many different areas of life. They also can help to some of the barriers that were mentioned earlier and all the different challenges that families with young children and communities face. And these healthy, safe relationships in early childhood really do lay a foundation for healthy relationships later in life. And we saw that in some of the comments in the chat room earlier. Some people grew up not even seeing examples of healthy relationships or not seeing many examples of that. And that is something that certainly isn't a guarantee that the person's not going to be able to establish healthy relationships later in life, but it certainly can be a risk factor. So we have really worked hard with a lot of our community partners to develop a lot of resources to help you make a difference with the children, or even, I should say, even more of a difference, because you're already making a difference every day. But we really want to make these resources accessible to you so that you feel equipped to help them in their relationship concerns and help promote these happier, healthier, and safer relationships in the context of whatever work environment that you are in. So I'm going to start with, in terms of our early childhood and families of young children resources, by sharing with you about our Sesame Street and Communities partnership in Guilford County, but also some of these resources certainly could be helpful across different communities. Maybe just for fun, this wasn't planned, but maybe just for fun while we're talking about Sesame Street, what Sesame Street character? Go ahead and put that in the chat room just to get everybody excited thinking about Sesame Street. I will personally share that my favorite Sesame Street character, although you don't see him very much anymore, Snuffleupagus. So I've got any other Snuffleupagus fans out with us. Oh, I see one. Lori is a Snuffleupagus fan. So that's just for fun. It's for fun, but also because I think that for many of you are probably already aware of the Sesame Street and Communities resource. Just the enthusiasm that I'm seeing in the chat room right now shows part of why these resources are so valuable. So here in Guilford County, we were fortunate to be selected as one of the first 3 pilot communities when Sesame Street wanted to start working to build. I love seeing all of these in here. I wish we could just have a whole chat about favorite Sesame Street characters and why, but I'm going to try to stay focused. But we were very fortunate back in 2015 actually to begin partnering with Sesame Street and Communities. Definitely, I invite you and encourage you to check out their website, sesamestreetandcommunities.org. Again, many of you are probably already familiar with these resources. We do whole full trainings on these resources through our collaborative, which you can see the different organizations. We work with Guilford Child Development, the Guilford County Partnership for Children, Ready for School, Ready for Life, and the United Way of High Point, along with the Healthy Relationships Initiative with this collaborative. So our local collaborative is really great. We've had opportunities. Last May, we brought Cookie to town. We're hoping to bring Abby Cadabby to town later this year, but that might be impacted by COVID-19, but we're trying to figure that out. But even though we've got this great local collaborative, these are wonderful resources that it does not matter if you're in Guilford County or not, that are available to you. And that's why we wanted to go ahead and share a little bit about them with you for those of you who may not be familiar. So the best way to connect with their resources is through Sesame Street and communities.org. When you go to the website, you can see kind of in the corner of the screen up here where it says Espanol and provider. And you see the little caret. And so the provider piece means that actually they have two interfaces for their website. They have a provider portal and they have a parent/caregiver portal. So for you as one of the important reasons to make sure that you're in that provider section is that you can see the professional development link will come up. They have got some wonderful online professional development programs free of charge, but they've also got a lot of resources that you could consider using in your work. Another thing that we love about working with Sesame Street and communities is also next to that provider piece on the menu, you'll see the Espanol, and the vast majority, almost all of their resources are available in both English and Spanish. And I know that was a question about our HRI resources earlier in the chat room. All of those resources are able to be in Spanish and English. I will say we've talked with them about other languages, and there are certain that are available, a limited number of resources that are available in other languages, because we know in our local community, as I'm sure in other communities, that there are a lot of other languages beyond English and Spanish. So we could talk all day about these resources, but I'm going to just talk a little bit more about some of these resources, what they have available. So they've got digital and print storybooks that are available. They've got a lot of videos using some of our favorite characters, the ones that you are all mentioning in there. Printable handouts that you can use and incorporate into services or to your classrooms. They've got some really great interactive programs and games. So for example, I will tell you just one of my all-time favorite resources is, I'll show you the topics in just a moment, but the trauma resources and the Comfy Cozy Nest Interactive, I just totally love it. So I would definitely recommend you check that out, but there's lots of other ones as well. They've also got some great workshops, which is just a real big set of different resources that they have around some of the top areas. I've also mentioned the professional development. I'm not sure exactly which ones, but I do know that locally Guilford Child Development has worked to have some of their professional developments approved by the North Carolina credentialing body so that those can apply for online continuing education. And they also have a really user-friendly website. So for example, if you're working with very young infant and toddlers, you can search by age compared to if you're working more with the pre-K, preschool age group, as well as how much time it takes to complete, which can be really helpful for you as providers if you've got a longer period of time or a shorter period of time, or even as parents too. In terms of the different topics that they have available, this is not a complete list. So make sure that if you go on their website that you take a look at the resources that they have available. But real high level, just to share with you about their resources, they really sort of have them in three different categories. One is around school readiness. The other area is around health and well-being, so kind of nutrition and healthy eating. And then the third area is around social emotional wellness. And for me personally, with my background in the family counseling world, a lot of my work has related to family violence and abuse. The thing that I love the most about these resources is how they use the Sesame Street characters to really help young children navigate difficult topics. So you can see a lot of those difficult topics listed on there: trauma, parental substance abuse. They've got some resources on homelessness, foster care, community violence. Later this year, they'll be adding some resources around gun violence to that community violence piece too. And I will say too, very specific to this moment. They have been doing a wonderful job of setting up some resources specific to COVID-19. Some of you a couple weeks ago may have seen that they did a whole, I think it was an hour-and-a-half program on CNN where they had the characters, and personally, I thought it was the best coverage that I'd seen of the pandemic so far because of the way that it just broke everything down. But they've also set up a each other resource as well as a health emergencies set of resources just within the past couple of months. So we work very closely with the Sesame Street and Communities partners. I could truly go on all day about these resources, but if you're interested in learning more, if you have questions, if you check them out online, please do so. But we are, we have been so honored to Sesame Street for the past several years and have become very familiar with those resources. So if as you start looking at those resources, have some questions, do feel free to reach out to myself or Camila, and we know the answers to a lot of the questions. If not, we've got our contacts at the Sesame Street headquarters that we'd be happy to reach out to. But they're wonderful resources, and so we've been really grateful to partner with them through the Healthy Relationships Initiative. So Camila is going to shift back to talking about some more of our HRI specific resources.
Thank you, Christine, for that overview of Sesame Street and Communities. And personally, my favorite part about that partnership is seeing how excited the parents get about the resources. The kids are super excited, of course, but it's always fun to see the parents get excited to see Sesame Street. Reminds them of their childhood as well. So now I'm going to dive into some of the different HRI specific resources that we have to offer. And so on the screen now, you'll see, Christine mentioned earlier, and she shared a screenshot of our website. And so when you first get to our website, you will see 3 different options. And the first one is, how can HRI help you today? So when you click on that, you will get some different sort of audience, or we break it up by audience and topic. And so you can navigate our website by looking at different topics like parenting young children or support for working with teens. Or you can just choose to browse our database of resources through our blog or our e-learning center. So there's different ways to kind of engage and research the different resources through our website. And again, our website is www.guilfordhri.org. And so what we wanted to do today was give you an example of one of our HRI sample parenting tips video, just to give you a sense of the different types of resources that we provide. We've got I've mentioned some different tip sheets, I've mentioned our blogs, but we're also super interested in engaging parents and families through videos, and we've started to explore that more as well. So the video that we'll show you in just a bit, you can find it on our Facebook page under our videos at Healthy Relationships Initiative. And I encourage you after today's session to just kind of take a look at our Facebook page and see the different videos we have. They're pretty short, and they're really great to sort of use to introduce different kinds of conversations with your families, or to just give as a resource for your families to kind of work on at home. So a lot of different ways to apply these interactive media to your work. So with that, we'll go ahead and show you one of our parenting videos. Christine, I think you'll have to unmute your screen in order for the sound.
Always easy.
That works?
To be honest, parenting isn't always easy. Sometimes arguments, tantrums, or just a messy home can cause us to lose our tempers. Getting frustrated and angry is a part of being human, but we want to make sure that we handle those emotions in a healthy way. There are plenty of simple tricks for calming down even in the face of the most trying toddler. Here are a few. Calming breaths. Breathing is a powerful tool. Our breath helps regulate our emotions and can affect our body as well. When you feel yourself beginning to lose your temper, take a couple of deep belly breaths. Focusing on the movement of the air in your body can offer a distraction. while the rhythm of breathing, heartbeat, and leave you clear-headed and ready to handle the situation. Find the root of your emotions. Often when we lose our temper, the problem is not the one toy left on the floor or a child's 100th question. Intense anger comes from bigger feelings of helplessness, fear, or failure. If we find ourselves lashing out over small things, we should look at why we feel so upset. Stress at work, feeling unappreciated, or worrying we are not good enough as parents may be the true culprit. And this knowledge lets us attack the feelings at the source instead of attacking our children or partners. Be willing to apologize. No matter how hard we try, there will be times our anger gets the best of us. If we go too far in yelling at an apology may be in order. Owning our mistakes not only allows us to process our emotions, but also models to our children how to ask forgiveness. Mistakes happen, and apologizing for them is just another way of showing our love and respect to those we care about. To see the rest of our tips on managing parenting stress, visit guilfordhri.org and follow us on Facebook and Twitter.
And Camila, if I could just jump in really quickly, because I saw we had a question about if we have resources specific to dads and grandparents. And one of the things that I just wanted to point out, and I think that the timing with this video is really perfect, because what we try to do in our resources, the reason why we use pandas is because they're neutral, they're sort of age neutral. And so for the most part, what we really try to do is develop resources that are, you know, sort of generalizable and not specific, so that if a dad or a grandparent was watching that video, they could see themselves in the panda. So we sort of talk more about that. Pandas are actually sort of a big part of our strategy for keeping our resources accessible to everybody. But we do have in our blog some resources specific to grandparenting and fatherhood too. So just wanted to mention that real quick, but Camila, you can go ahead.
I appreciate that, Christine. And I think talking about the fact that we use pandas is a great way to really just highlight the fact that our resources can be applied to many different family situations and family dynamics. And so hopefully now you have a sense of some of the different resources that we provide and some of the different topics that we like to focus on. But I'm going to dive in a little bit deeper and tell you a little bit more about our online resources through HRI. And these, I'm a little bit biased because this might be my favorite part of what we do. I love everything that we do, but our relationship boosters really stand out to me as a potential resource for families. And so our relationship boosters are basically their 1-hour interviews or interview-like discussions where typically Christine asks an expert on a particular topic some questions about whether it's a relationship topic, a parenting, or a lifestyle topic. To give you a sense of different boosters we've done in the past, we've had some topics on effective co-parenting after divorce. We've had relationship boosters on managing busy family schedules or talking with kids about race and culture. And currently we have 24 episodes available in our e-learning center, and they're available in both a video or an audio format. So you don't necessarily have to have the video component. You can download the audio and listen to it at a later date. And so I'll go ahead and post that link in the chat room now so that you can take a look on your own time. You can take a look at some of the different pre-recorded sessions that we have. And as promised, I promised you a couple of insider tips today, and so I'll give you another one in regards to this booster. Our relationship boosters are actually coming to an end in June. We've got a couple more planned, and while we'll still keep the recorded sessions available on our website, we're actually adapting this booster idea into a Healthy Relationships Initiative podcast. So we're hoping to be more responsive to kind of this growing podcast world. People are engaging more with that. And so our goal is to launch our podcast in the fall. So we encourage you to stay connected with us and be on the lookout for that. The format might be a little bit different, but the idea is the same, sort of this concept of diving into different relationship topics and coming up with strategies for families to adopt now. So we're really excited about that. And so we encourage you to check out the last couple relationship boosters and be on the lookout for our upcoming podcast. But if you take a look at the screen, you'll also see some other resources for parents. I mentioned earlier about our parent toolkits. I'm going to specifically talk about our parent toolkit for families of young children. And so this toolkit has a number of different components. It includes reflection activities, conversation starters, and tip sheets. And they're all designed to support families of young children through working on different topics. So some topics can include managing stress, or strengthening communication, or solving problems and conflict as a family. So you can see how some of these resources would be really in line with the work that you're doing and can be a great supplement to what you're already doing. Finally, the bottom two images on the screen are two of our parent modules that I mentioned earlier. These are the ones that take about an hour to complete, and they don't need to be done in one sitting. And so you'll see the topics are single parent superheroes and parenting excellence. We are looking to add more of these modules to our e-learning center, but these are a great resource for parents and families. And the one thing about the single parent superheroes is that can apply for both single moms or dads or grandparents. So through our work, we really do try to address all different types of family dynamics. Also, we do cover a number of parenting topics on our blog, and we do have a number of face-to-face programs as well. So we've got a wide range of resources to provide and offer, and I think one of the best places to start to become familiar with our resources is to check out our website, and then also to dive into our e-learning center as well. And so with that, we're going to move on to our final chat room discussion. I want to thank you for being so interactive in the chat room. It makes it almost feel like we're all there together in the same room. And so here's my first question to kind of wrap up our thoughts for today. And I'll go ahead and also post that into the chat room right now as well. So that question is, what is one way that you could infuse some healthy relationship promotion programming into your organization or work? So what is one way that you think that you can really bring this idea of healthy relationships and infuse that into the work that you're already doing? And it requires a little bit more thinking for this answer. So we'll give you a chance to kind of answer. I see social media, absolutely. I think social media is one of the more powerful ways to really communicate with families and youth today, and also just an easy way to get information out there. Sharing resources with school, staff, and community. As a former school counselor, I definitely love that answer, because one of the things that I often found is that there just isn't much healthy relationship programming or curriculum available to schools. And so bridging that gap is a really great way to target families and support them. I'm seeing Facebook and meetings with families and sharing information. And so really the theme that I'm seeing here is getting the information out there, right? There's a definite need to just disseminate this kind of information. And the more creative we can get with the way that we deliver that, the better, the more beneficial for our families. And so here's my second question for you today. What other resources or topics would you like us to consider addressing or developing through HRI? We're in a unique situation right now where most of the content we're developing is online and virtual, but that also allows us a ton of flexibility and creativity in what we do decide to produce moving forward. So if you've got any ideas for us to address or develop, we'd love to hear them. We're always looking to just make sure that we're serving the needs of the community. So I'm seeing some really great information, and immunization information for parents makes me laugh as a former elementary school counselor. There needs to be a webinar just on that, I think. So with that, we really appreciate your responses in the chat room. I will go ahead and hand this over to Christine for a final thank you, but I'll go ahead and say thanks for your time today. We'll send some links in a follow-up email. We'll make sure that we get that. And we encourage you to sign up for our newsletter and to also go ahead and follow us on social media. So with that, Christine?
All right, yeah, so that brings us to the end of our time, but we will stay in the chat room for just a few more minutes, I guess, assuming they let us, to make sure that if there are any final questions that come up that we can answer them. But thanks so much for the great presentation in the chat room today. This is definitely a different format, But we hope that you'll find these resources to be helpful, and we're just grateful for your participation and especially the positive feedback today. So please do visit our website as well as connect with HRI on our social media, and we hope that you'll find the resources and information that we discussed to be valuable to you and your work. Go ahead, Eric.
Yes. I just wanted to say thank you so much for a really amazing presentation and being a part of the virtual conference here. So please, everyone, thank Camila and Christine for a great job. And as far as I know, this does not shut down at a hard time. So if you want to have a little more discussion in the chat room, I think that's perfectly okay.
This is Scott. That's totally fine.
Yeah. And want to remind everybody that this was recorded and will be on the conference website in this session description as soon as possible. So again, thank you so much, and y'all have a good afternoon. I'm going to sign off, but keep chatting.
All right. Thank you.
Thank you.